And thanks for staying with us. If you're on Medicare, you may now be eligible for some free health care screenings.
Rich Carruthers from AARP joins us now with the details. Rich, tell us about the new payment options when it comes to preventive care.
Right. Well, first, Lauren, thanks so much for giving me an opportunity to come in and share some really good news with the seniors in Oklahoma. As of January 1, all Medicare beneficiaries in Oklahoma, and there are about over 500,000 of those folks, are now eligible for selected free preventive screenings. Previously, Medicare paid for a portion of the preventive screenings, but the beneficiary was required to pay the other part.
Okay.
And now those benefits are totally free.
Okay.
Awesome.
What kind of screenings are we talking about?
Well, there's a wide variety of screenings that are available. Just to mention a few, are available at no cost to the Medicare beneficiaries are cardiovascular screenings, diabetes, mammograms, colorectal cancer, and then your flu vaccines and a whole series of other immunizations.
Okay, and they're also eligible for free wellness screenings, just going to the doctor to get a checkup?
That's right. You know, when a person comes on Medicare, for instance, when I came on Medicare last year, I was entitled to a free Welcome to Medicare appointment, which is very helpful. You meet with your primary care doctor, they get to know you and go through your health records and so forth and so on. In addition, now you're eligible for a yearly wellness checkup with your physician, where they can, again, do an exam, go over your current health status, and, you know, do these preventive screenings as they're indicated for you.
Along with all the blood pressure, cholesterol, and all those things.
Those are many of those, and that list is available of all those things that you can get.
Okay. Now, let's talk about this donut hole.
Okay.
What is the donut hole? Kind of explain the...
Well, the donut hole has to do with Part D Medicare, which has to do with the prescription drug program. So if you enroll in Part D, which is the prescription drug benefit, then you'll receive support up until you've spent a certain amount of money. In this case, for this year, it's $2,800.
Okay.
After you've spent $2,800 and received support for that, you fall into the gap, or what they call the donut hole.
Right.
During that period of time, you don't receive any support, although you're continuing to pay a premium until you get up to having spent about $4,500 for the year. And then you begin, that puts you in the catastrophic care class, and you begin to get help again.
Okay.
Now, the good news is that in 2011, AARP and others have worked very hard to try to close the donut hole, and this is going to be done in a gradual fashion. But in 2011, beneficiaries who are in the donut hole get a 50% reduction for brand name medications and a 7% reduction or discount on generic drugs. So this is very helpful for people that are in the donut hole. Many of them are seniors who have difficulty affording their medications, and this is a way that they can do that. And as the years progress, they'll get a greater and greater discount until the donut hole is eliminated in 2020.
Awesome.
Yeah.
Okay, and people can call you or log on to your website if they want all of this information.
We also have created a donut hole calculator that's available on the AARP website. If you would put your medications in, you can anticipate when you might fall into the donut hole, and therefore know what you need to do in your planning purposes. And we invite people to go to the AARP donuthole.aarp.org for that, and go to our local website to see information such as what preventive screens are covered and how to go that. But we think it's a wonderful opportunity for people, even if they have not been able to afford it before, to go out and see their doctor, get preventive screens, take care of health issues before they get really bad.
Thank you so much for sharing all this information. Of course, we have a link to all this also on our website at news9.com.